Thank you, everybody, for joining us for the Vitalyst Health Foundation Medical Assistance Grant Information Session. My name is David Martinez. I direct our grants program and civic health portfolio at Vitalyst Health Foundation. I'll be the lead facilitator for the session today. Before we get started, just a couple of housekeeping notes, and I will toss it over to my colleague Sergio.
Buenos días a todos los que necesiten ayuda en español. Aquí en Vitalyst tenemos varios miembros del equipo que les pueden ayudar en español. Entonces, si tienen alguna pregunta, nos pueden escribir un correo a conversemos@vitalysthealth.org y ahí les responderemos cualquier pregunta que tengan. Go, David.
Thank you, Sergio. We also have closed captioning services available through the Zoom function, so you can add those accessibility measures as needed. And we also have ASL interpreters, Kelly and her colleague Sarah, who will be switching off between the webinar. If you would like to see them in Spotlight, you can change your gallery view to a side-by-side option. All the lines are muted upon entering the webinar, but at the end of the presentation, we will stop sharing screen and be in community together and have an open question and answer period. However, if you have any questions that arise during the slide deck, feel free to use the chat room, and my colleagues Michelle Goodthunder or Erica Foster will answer those to the best of their ability, and then we can resurface them during that live question and answer period. This session will be recorded, and the slides and accompanying materials will be available at vitalysthealth.org and will also be emailed to all the participants who registered for today's webinar. So for those not familiar with Vitalyst Health Foundation, we are a health foundation based in Phoenix, but have services and partnerships throughout the state of Arizona. The medical assistance grant program that Vitalyst manages is restricted only to services provided in Maricopa County. So if your organization or efforts are outside of Maricopa County, you would not qualify for this particular grant. However, in total, we have a vision that all individuals and communities in our great state of Arizona are healthy and resilient. And to see that vision through, we're on a mission to connect, support, and inform efforts that improve the health of individuals and communities in Arizona. While we are a health foundation, we see health as more than just health care, though access to affordable quality health care is important to living a healthy life. You might be familiar with the elements of a healthy community wheel that you see here. And while this doesn't have a direct connection to the medical assistance grants program per se, we wanted to provide some context to Vitalyst Health Foundation in general and how we see health and where we often see mission alignment. As part of our grants program, we have other grant opportunities outside of the medical assistance grants that support collaboratives working towards systems change. If you're interested in learning more about the technical assistant grant, the Spark grant, or the systems change grant, you can visit vitalysthealth.org. And if you're interested in exploring those, you could join our monthly Vitalyst 101 information session and complete a discovery intake form that's on the website to discover partnership if there's greater alignment with those grant opportunities. Both the discovery intake form and the 101 session registration link is available at vitalysthealth.org on the grants and partnership webpage. We do have an open door policy at Vitalyst Health Foundation to discover partnerships with organizations that are mission aligned and grants aligned. And that is through that discovery intake form that I mentioned was on vitalysthealth.org and the grants and partnership webpage. What we're talking about today specifically is our medical assistance grant, which is a really unique grant program for Vitalyst Health Foundation because it's part of the history and legacy of Vitalyst Health Foundation. We're celebrating our 30th anniversary this year, but before we were a health foundation, we were the St. Luke's Hospital System that a lot of Phoenicians and Maricopa County residents are familiar with. The St. Luke's Hospital near downtown Phoenix and the other St. Luke's Hospital in Tempe. Those used to be a nonprofit hospital and in the mid 90s sold to a for-profit entity. And with that sale, the portion of the sale formed an endowment that has since become Vitalyst Health Foundation. Once the sale happened, there were a couple of donor restricted funds from St. Luke's hospitals that came under the management of Vitalis Health Foundation. They were what was referred to as charity care, where very generous Arizonans contributed to funds to provide and cover direct services provided at the hospitals for low income and underserved residents in Maricopa County that would not be able to have those services covered. Since they are restricted funds managed by Vitalyst, they have a very specific criteria that we have to follow, which is why the initial criteria is that it's restricted for direct services provided only in Maricopa County. So again, if your efforts and your organization is doing work outside of Maricopa County, you would not qualify for the medical assistance grants. Because they are such a unique grant type for Vitalyst Health Foundation, we open up this grant cycle every 3 years and run it on a 3-year grant cycle. So the grant cycle for this, or the grant period for this grant timeframe would be 2026 to 2029. It is an open request for proposal process that we can accept applications from nonprofits or fiscally sponsored organizations that provide direct services, treatment, and program areas in 4 grant categories. Direct services for hearing, vision, substance use, and heart and lung. So while we have one medical assistance grant program, we have 4 different grant types that you might qualify for individually or multiple if you have efforts, direct service efforts in different categories. The direct services that can be covered by the grants are to support direct services for low income and underserved populations in Maricopa County. You can see here some specific examples of direct services that have been covered by the medical assistance grants, including but not limited to screenings, evaluations, diagnostic testing, exams, and surgeries. Client-related equipment such as assistive devices and adaptive equipment. This would be for hearing, for instance, hearing aids or molds. For vision, it could be like glasses or contacts. The grant can also cover service-related program management and administration, such as provider expenses, vouchers or referrals for clients to see providers, and any program-related staff costs that are directly connected to that service-related program. It can also cover any client service that's needed that is a barrier to that client or patient accessing the direct service, including transportation and interpretive or translational services. As I mentioned, there are 4 grant categories for the medical assistance grants: hearing, vision, substance use, and heart and lung. Each has a different restricted fund, so has a different total available funds in that grant category. So for the hearing grant, as part of the medical assistance grants, Each year, we have a total of $375,000 to distribute to partners providing direct service for hearing. Because there are many hearing partners throughout Maricopa County and providing services throughout Maricopa County, each application can request up to $150,000 per year for a total of 3 years. So each grant would be up to $150,000 per year for hearing. You do not have to request $150,000 if your entity doesn't have the capacity or the program bandwidth to utilize all of those funds. You can request up to that amount. Similarly, for vision, you can request up to $150,000 for per year, and we have $350,000 total in this restricted fund for vision direct services. For substance use, we have a total of $25,000 total in this restricted funds. So we will have one grant partner who can access $25,000 per year. That is a clarification from previous years because we wanted to set the expectation of partners on how competitive that particular grant category will be. For heart and lung, we have a total available bucket of restricted funds of $230,000. So each applicant can apply for up to $100,000 per year. This is also a change from previous years. This used to be set at up to $50,000. So because we had more total available in the restricted funds for direct services for heart and lung, we increased the total available that an applicant can apply for. So as a recap, we will only have one substance use grant partner. However, we can have multiple hearing, vision, and heart and lung partners because we have more funds available in that bucket. We are opening our grant cycle today with this information session, and our grant portal will open today as well. As I mentioned, we have an open door policy, so can discover partnerships with potential and prospective applicants. If you have any specific questions about direct services and seeing if they may be covered through the grant, please go to vitalysthealth.org, our grants and partnership webpage, and complete a discovery intake form. In that form, you would select interest in the medical assistance grants. And once we receive that, you'll receive a prompt to then schedule a time for us to chat and answer any questions you have. This is optional, not required, but highly encouraged if you are especially a new prospective applicant. The grant deadline is April 16th by 5 p.m. Arizona time. And once we close that grants portal and the deadline passes, we go into our grant review process, which includes our grants committee of our board and ultimate ratification of the grant awardees, grant partners by our full board. That Vitalyst board meeting happens in late June, and as soon as that vote happens, we will then send award notifications and also all declinations. Again, this is a 3-year grant period, so this grant will the funding and partnership will begin July 1, 2026, and go until June 30, 2029. So just as an overview, here are the top line grant criteria for our medical assistance grants. We are only accepting applications from nonprofit or fiscally sponsored organizations. So if you're a private provider or private practice or an LLC, you would not qualify for this grant. That nonprofit or fiscally sponsored organization has to provide direct service in one of those 4 categories: hearing, vision, substance use, or heart and lung. And if you do provide services in multiple of those categories, you can submit separate applications for each of those grant categories. The service has to be provided to populations, low income and underserved populations in Maricopa County. And your application will include a budget that is consistent with the proposed scope of work for the direct services over a 3-year time period. In the application, you will have a field to provide a budget narrative, and there will be a separate field to include a budget spreadsheet and with a template that we provide. The reporting requirements for our medical assistance grants um, are that you maintain a log recording direct services provided to the individual. So a log of every individual that you serve and any of any and the service provided. Um, the report is a mid-year report and an annual report, so two a year, usually due in January 31, and then the second one June or July 31st to capture the 6-month time frame, July 1 to December 31st, and then January 1 to June 30th. So to be more specific related to what your proposal should include and how it reflects each of those grant criterias, the direct service portion of the grant application should clarify how you are providing direct services relating to one of the four grant categories. Again, hearing, vision, substance use, or heart and lung. Again, these are efforts that provide and support direct services. And again, those are those examples on the screen provide you with some clarification on what can be covered through the grant funds. But this is not an exhaustive list. If you have more specific questions, please complete that discovery intake form and we can answer any more specific questions to ensure that the direct services that you're interested in having covered with this grant are indeed able to be covered. The big question on this point is pretty much any cost related to direct service, you providing direct services for low income and underserved populations in Maricopa County. The specific points listed are the questions that our grant reviewers will ultimately ask as we are evaluating and reviewing each of the applications. So as our former president and CEO used to like to say, this is an open book test. These are the exact points that our reviewers are assessing as we review your applications. So long as you answer these specific points to the best of your ability, the stronger your proposal will be. So these are the components for the direct service criteria of the medical assistance grant. The next criteria to clarify in your proposal for the medical assistance grants are the populations served with the grant. Again, the grant is restricted to be covered for direct services only for low income and underserved populations in Maricopa County. We define that in three ways. You can either have the funds cover direct services for individuals that qualify for any government assistance program, such as SNAP or the food stamp program, Access, our state Medicaid system, Kids Care, which is our child health insurance program, WIC for women, infants, and children, or for direct services provided to low income and underserved kids who access free or reduced school meals at school. Other government assistance programs are eligible as well, so long as they are income eligible requirements. So a client can have their direct services covered if they are on a government assistance program or if their annual household income is less than 250% of federal poverty guidelines as set in 2026. So for this year, that amount will be for an individual earning $39,900 or less, or for a family of four, $82,500. So the direct service for low income and underserved populations has to meet one of those two requirements. And your efforts should also be focused on supporting residents experiencing the greatest disparities in health. Again, this is an open book test. These are the specific points that your proposal should clarify in the criteria around population served. So long as you answer these to the best of your ability, the stronger your proposal will be served or will be reviewed. And for clarification, the slide deck, again, that you all will receive as a follow-up email has the federal poverty guidelines. These are the 2026 federal poverty guidelines for 250% of FPL. And that is linked, the citation is linked on this slide deck for future reference. As a reminder, these are the award amounts, so you can apply for up to $150,000 per year for hearing and separately for vision. The substance use grant would be a request for $25,000, and we have one grant in substance use available. And then for heart and lung, the grant request can be up to $100,000. So in your grant proposal, you will have the opportunity to provide a budget narrative focus on these specific points, and also we'll upload a budget spreadsheet using a template that we provide, and that's available linked here on this slide deck and will be available in the grant portal and on our website as well. So if you see alignment with your efforts that support direct service for low income and underserved populations in Maricopa County, you are welcome and invited to schedule that discovery consultation with me. And again, you would go to the Partnering with Vitalyst webpage on vitalysthealth.org and select interest in the medical assistance grant on that discovery intake form. Once you receive it, you'll receive a follow-up prompt to schedule a time for us to chat and have a virtual 30-minute conversation to answer any more specific questions. These meetings are not required, but highly encouraged, especially again, if you are a new prospective partner. Because those aren't required, we have the online portal for grant submissions open. You'll receive this link in the follow-up email as well. Our grants management system is called Akoya Go. And in that portal, you will have separate fields to cover the criteria for direct service, another field for population served, another field for the budget narrative, and a field to upload the budget spreadsheet. There are character count limits for each of the fields. You can see there 4,000 character count limit for direct service, as well as population served, and a 2,000 character count limit for the budget narrative. Our evaluation team, our grant review team, will review these and score them based on those scoring points, 40 points for direct service, up to 40 points for population served, and up to 20 points for the budget narrative and budget spreadsheet. Again, assessing using those specific points covered for each criteria as our assessments. Each of these grant criteria has their own fields, but as you want to begin drafting a proposal, these ultimately turn into about 4 pages total to give you a sense of what the total application would be like. But again, you won't have the opportunity to upload just one document. There are 3 separate fields for you to provide the content for your direct service criteria, for the population served criteria, for the budget narrative criteria, and then a separate field to upload that budget spreadsheet. So that concludes the slide deck and the review of the Vitalyst Health Foundation Medical Assistance Grant Program for the grant period 2026 to 2029. I saw a flurry of emails of comments in the chat room. So we'll toss it to my colleague Michelle or Erica if you want to raise up any of those that we could address and acknowledge in the recording.
Yeah, I was just gonna read them off so we can get them in the recording, and then from there, people can add more questions or go off mute. I'll start with the chat. So the first question is a list of previous awardees available? And that is yes. If you go to our Partnering with Vitalyst webpage, towards the bottom, there's an accordion that says current and past grantees. And then go into 2023 and you can get the latest list from there. Next question. Are you particularly interested in applicants who are collaborating? Medical assistant grants don't require a collaboration, but it's always welcome.
And
Next,
Michelle,
yeah,
quickly to that question, I would just add sometimes collaborations might strengthen your application if it provides greater impact for and greater direct service, so more people served or more units of service provided.
it's a good point. And there was another question related to that, if a MOU is required between the partners, and I don't believe so.
It is not a requirement for our grants, but it's always probably a best practice to have an MOU or a memorandum of understanding or some sort of formal agreement between partners, especially when funds are involved.
Thank you. The next one was a question asking how many applications were received for substance use disorder last time the cycle was open, and we received 8 applications last time. We anticipate there being a bit more, and as a reminder, we only have one grant for that of $25,000. Next question, are we able to apply in 2 categories? And that is yes, they can apply for each category as relevant.
Yes, you can apply in multiple categories, but you will submit a separate application for each of the grant categories.
Great, thank you, David. Um, okay. The question I haven't answered yet, if we're an organization based in, say, Pima County, but we provide direct services to low-income families and individuals in Maricopa, do we qualify?
The grant funds can cover direct services provided in Maricopa County. So you can be an entity based out of Maricopa County, but the services covered through the grant can only cover low income and underserved populations in Maricopa County. Those populations do not have to be residents of Maricopa County. The service has to be provided in Maricopa County.
Thank you. That's all the questions we have in chat. So if people want to come off mute or add more questions, you're more than welcome to.
Great. So as Michelle noted, if you have any questions, feel free to raise your hand, use the raise hand function in Zoom, or simply unmute yourself and we can acknowledge you for your question. If you do unmute yourself for your question, I will just note that we have ASL interpreters who prefer for you to speak at a slower pace so that they can follow along properly. Bethany,
Hi, friends.
hello.
Um, would you be willing to go over the financial requirements, like what financials that you need to submit for this application?
The financial requirements would include that budget template, the spreadsheet that we provide that you would upload as a separate field along with your budget narrative. We don't need organizational financials or audited financials. However, when you go to submit your application in the online portal, you will have a field to upload your tax identification number so that we can clarify and confirm that you are a nonprofit or fiscally sponsored organization.
It is so helpful. Thank you so much.
Yeah, thank you, Bethany. Any other questions for the live Q&A session? We have a question in the chat room from Tabitha. Hello, my friend. Is the grant limit if the grant limit is $150,000 per year, which could be 450,000 over 3 years, or $150,000 spread over the 3-year grant period, it would be the former, Tamitha. So if you apply, for instance, in the hearing or vision categories, you can apply for up to $150,000, and that would be funds for each year. So you multiply that by 3 as you did, and it would total a 3-year grant of $450,000. You're welcome. So for, separately, again, for the heart and lung, you can request up to $100,000 per year. So that 3-year grant total would be $300,000. Nicole asked, what are some examples of the programs, services, and activities that have been covered in the substance use disorder category? I can imagine these are things not covered by insurance or access. Correct. Um, if you go to the vitalysthealth.org webpage, you can look at our previous grant partners, our current or the current partnership we have for this current 3-year grant cycle is Phoenix Rescue Mission, and their substance use services provided on their campus here near downtown Phoenix. A previous grant partner for substance use was Crossroads, which provided medical assistance therapy programs that were covered by the grant here in Maricopa County as well. We know that the substance use ecosystem is broad and different aspects of treatment. So if you have any specific questions or if a particular treatment or direct service is covered by this grant, I would recommend setting up a time for us to chat via that discovery intake form. The video recording will be available after the session, including the slide deck and accompanying materials. They will be sent to everyone who registered for this session, and they will also be posted to the Partnering with Vitalyst webpage at vitalysthealth.org. Danielle asks, can you clarify what info grantees need to report about the patients, participants they served with grant funds? Yes. The reporting requirements, we try to make it as easy as possible. You simply need to maintain a log of each client that you serve utilizing the funds, how they meet those income eligibility requirements. Again, either eligibility in any government assistance program or if their income, it falls within 250% of the federal poverty level. And the daily log or the log of service should include how that population is facing the greatest disparities in health. That is broad, but can include things like people with disabilities, the LGBTQ community, or rural communities that may exist and that service that may exist in Maricopa County. I also want to note, as part of the population served, we do not have any restrictions on immigration status. So the funds can cover services provided in Maricopa County for undocumented residents, for the undocumented community and services provided in Maricopa County. And then you maintain those logs, and we would be able to access, we being Vitalyst would be able to access those logs to maintain accountability. But you do not have to submit those logs during the annual or mid-year reporting. The mid-year or the reporting is a quick questionnaire for you to reflect the total amount of clients served, the service provided, and the units of service provided. So for instance, if you are a Vision grant partner, you might serve 500 people in a 6-month time frame and provide 500 vision screenings, vision exams, 500 glasses if needed, or different units of service for more specific things that are covered like surgeries. We try to make the reporting as easy as possible, and we would not be able to do it without our colleague Erica Foster. Deborah asked, is there anyone available to answer questions during the application process? Yes, we can answer questions during the application process leading up to the deadline. We would highly encourage setting up those discovery consultation calls sooner rather than later because there is a short window before the deadline and our calendars tend to fill up quickly. But just complete that discovery intake form at vitalysthealth.org and the Grants and Partnership webpage and select interest in medical assistance grants. We'll receive that email and you'll receive a prompt to schedule a time for us to chat. That initial consultation is up to a 30-minute virtual conversation. We are open and accessible during the application period because we want to ensure that you are indeed aligned with the grant before you submit an application and don't necessarily waste your time on the application if it's not aligned. Great questions in the chat room and a few live. Any remaining? Okay. Well, just to reflect on Deborah's point, even if you have any questions throughout the application process, don't hesitate to reach out through that discovery intake process so we can set up a time to chat and answer your questions. We try to provide as much technical assistance to the application and the grants portal as needed, all without actually writing your grant for you. But look forward to those conversations and to reviewing your applications as we move into the review process. Again, if you've had any questions, don't hesitate to go through that discovery process. We will be sharing this recording, the slide deck, and accompanying materials in a follow-up email, so anticipate that in the next day or so. And again, thank you so much for your time today, for all of your work in the community, and we look forward to potentially reviewing your application for the medical assistance grants. Thank you so much for joining us.